WEFM, that new fresh sound.
WhatsApp us or call us at 457-9997. Activated Mornings on WEFM 99.9 is on now.
And the time right now, Fiji, it is 8:14, and as mentioned earlier, sorry about that, we will be heading into we're continuing our medical conversation series with Dr. Tammy Williams, and this morning we are touching on the topic of hypertension, causes, risk factors, and prevention. So in studio, you have Dianna Cain, Nicole Joseph Chin, and myself, Roleza Samuel, and of course, Dr. Williams is in studio with us. Good morning to you, Tammy.
A pleasant good morning to everyone. Good morning to you, Roleza, Dianna, everybody, right? And our fellow Vincentians.
And non-Vincentians.
And non-Vincentians, yes. And what season is this? Independence.
Well, that's
a couple
one
seasons, actually, yeah.
Political too.
And Christmas approaching, so ham and
Roleza, I
tea.
like the color.
Don't even. This is maroon, so I have you to know, okay?
Noted.
So let's get into it. So what is hypertension all about?
All right. So anybody want to have a go before I start my whole,
Well, you see this teacher here, you need to bring a sticker book. So how many stickers I have now?
Plenty.
So let's see, without going into too much so that you can do your thing. Hypertension is what we know as being a pressure case in local terms, which is it correct to say it's too much salt in the body?
Well, that will that could cause hypertension. Yeah,
Okay.
let's put it that way.
Okay.
Yeah. But you get points. You get plenty of points. Really, is
I was going to say the same thing with salt, and I would tell you maybe something that was funny to me, but I could never understand how people have diabetes and pressure. I could never understand how
Nothing
people have a
cancel it.
situation with sugar and salt, because to me they're supposed to cancel out each other, right? But yeah. I just know pressure to be about salt, not too much salt in the system or something to that effect.
And then diabetes is the sugar. Oh, yes, it is.
They're supposed to cancel out each other, yeah. But yeah, that's my little thinking,
I like it.
Nicole, you here with us?
Present, miss.
You see that today?
Because I want to show up in class. It's an arterial disease or disorder. Well, not disorder, but disease.
Look who's the bright girl among us.
Right, yeah. Sometimes hereditary, sometimes I don't remember what's the other word for that. But acquired, yeah. And it will have symptoms that can contribute to heart issues, where the pressure of the blood, because it's arterial, can contribute to
Heart issues, which is very, very important.
and other circulatory ailments, including embolisms and you're the expert. I'm not going to use the big words. I done.
She answered the question for full marks.
I call using big words on us. Embolism, not even blood clots, but embolism. All right, Nicole, good girl.
Full marks.
Everybody deserves a big prize. I'm impressed.
We're sharing the prizes.
Okay, so hypertension. Why is it, before I get into the definition, why is it such an important topic? Just like with cancer, as we would have been discussing prior, hypertension, the symptoms tend to go unnoticed until there is some significant damage, right? So meaning that please go and do your routine general checkup, preferably yearly at least, so that we can identify diseases. Well, let me say conditions like hypertension, right? So what it is a chronic medical condition that occurs when there is, when the force or the pressure of the blood is elevated. And this pressure I'm talking about is the pressure of the blood against the walls of vessels, right? So vessels in the sense that the heart pumps blood to the entire body via vessels, right? So we get in the picture there, right? So it's due to this increase in blood pressure. So it is especially common in adults. However, it is becoming increasingly common among children. And the biggest risk factor is obesity, right? So I'm urging parents to be mindful of the diet that you give your child, especially, because that plays a big role in them developing hypertension as a child and later on in life.
I guess maybe even like the snacks that they tend to give, which is high in salt content as well too.
Yes.
Okay.
And then fats as well too.
Okay.
All these could contribute to risk of heart attack, strokes, and other stuff. Well, I mean, in children, not so common, but generally high cholesterol, high fat, which are the foods that you were talking about. But the snacks could also be high in, because we're focusing on hypertension, especially in salt. And the recommended, different places will have different guidelines, but ideally no more than 1,500 milligrams. Although I've seen 2,300 milligrams, which is like 1 teaspoon, more than 1 teaspoon of salt a day. Right? I know the 1,500 is very hard to keep.
No, not even that.
Per day, yes, please, per day. And that is me going based on the higher recommendation, which is like the 2,300 milligrams. But ideally, it should not go past 1,500 milligrams.
Okay, no, I wanted to get a
which
visual
is like
because
a quarter of a teaspoon.
right, because if you give us measurements, we're not going to know, right? So tell us like the teaspoon.
Right, so that's why I use the teaspoon as the example.
So half a teaspoon?
So 1 teaspoon is like around 2,300 milligrams. So you should not exceed that for sure, per day. And that is pushing it. That is the higher end. You understand what I'm saying? I just seen everybody frowning. I'm sorry.
No, because I know like if you're cooking rice, how much salt you put in it?
Wait, you just put salt when you're cooking rice?
If I put salt
when you're cooking rice?
Yes, please.
Yeah.
Oh Lord, okay. All right. Tell me.
Right. So continuing. So hypertension is a big risk factor for heart attacks, right? And other things, stroke as well. So in terms of the heart attack, it causes damage to the arteries because of this constant pressure, right? And also when we eat stuff like the junk food, the fried foods, and so it adds to cholesterol build-up within the vessels, right? Something called, the fancy term called plaque, right? And it is when these plaques rupture and a blood clot forms as a result. Because of the damage, the blood walls off, right? And this clot prevents blood from flowing to vital areas of the body, such as the heart, and the brain, right? And also what could happen, the clot could break off and travel to the brain, which is what happens most of the time, right? Causing the stroke. So that's just a little on the whys. It also can lead to heart failure. And how it does this, because of the constant, because of the pressure, the heart has to work harder, right, to pump blood because it's like resistance, if you understand what I mean, right? The vessels and you have this pressure build up. So it works harder and harder. And then it's like, like when you're lifting weights, the muscle gets bigger and bigger. So visualize that. So the heart muscle is getting bigger and bigger, right? And it also gets less elastic, right? We would say. And elasticity of the heart is important, especially when we want to push out the blood, right? Because the elasticity of the heart, right, when it expands, that is it accommodating blood to flow in, right? But if it can't expand properly, that means there's a reduced amount of blood that will be present to eject to go to the body, right? A little complicated, but that is basically it in a nutshell. So let's go to the epidemiology now. I got a little statistics in the Caribbean. It's like 41 to 47% in terms of the prevalence in the Caribbean. Let me just repeat that. 41 to 47%, right?
And what is the
in
age
the Caribbean?
And what's the age group?
So the age group is between 30 to 79.
Okay. And the sex? Any breakdown with the sex?
Well, generally, no, I didn't see any breakdown in the sex, but generally, males are at a higher risk. However, as the age increases, females become more at a higher risk than males. So typically, you say like around above 65 years. But prior, males are at risk of it more than females. So in the country, adults would have hypertension. So I mean, we see in significant numbers because 41 to 47 is like half the population, and in the US, it's pretty significant numbers. And it's highest in overweight persons, obese, as mentioned prior, African American, and then we mentioned the gender disparity. So in terms of the African American, there's certain influences, factors that make us, myself and the rest of us, on air today. Right, Nicole? I'm not sure about Nicole.
she dropped out a bit there.
Oh, okay. Right. So our cultural dietary practices, the food that we eat, lack of access to healthy food is common, especially in the lower socioeconomic class. And our lifestyles too. I mean, I'm not saying that the other races don't do it, but smoking and alcohol, all these things contributes to elevated blood pressure. So the causes, like Nicole mentioned, genetics. There's a strong family history. So if you know your parents, especially first-degree relatives, such as your parents, have hypertension, please do your checkups. You can do your home blood pressure monitoring. You can do that once a week, ideally daily. But, we have to, what's the word I'm looking for? Accommodate, I guess.
And when is it better to check the pressure? First thing in the morning or in the evening?
So,
or is there isn't necessarily a better time?
So not necessarily. There's something called ambulatory home blood pressure monitoring, right? But this is for persons who would have gone to the doctor and said the blood pressure is high, right? So this is just to confirm that it's truly elevated. So that one is like a series. Every 20 minutes, it would check the blood pressure for accuracy, and that is the preferred one, right? As opposed to you check it which you can do as well in the morning and the daytime, but generally it should be lower in the night.
Okay.
Right, except for certain conditions too, obstructive sleep apnea, right, which is a secondary cause, because they're primary and secondary causes of hypertension, but that can cause elevations in the nighttime, right, and daytime sleepiness. So, I mean, all of this to say, it depends on the situation, because some persons, when they go doctor, they get very frightened and scared and the pressure goes up, We call that white coat hypertension. Other persons, and then when they check it at home, it's fine. It's just when they go to the doctor. So that's not a true reflection. So if the doctor visits is higher than the home visits, that's not too much of a concern. But there's something called masked hypertension, which is the opposite. So at the doctor visit, it tends to be lower, like you're checking the doctor, right? Mm-hmm. And then at home, when you're doing the reading, and that one is more important. So that one more than likely would require treatment. So at home, the home blood pressure are elevated. Readings are elevated. Okay. So I would say generally there's no specific preferred time, right? So yeah, like a balance during if it's once a day, I guess when persons come home on evening, they could just check the pressure, right? Mm-hmm. Especially after a hard day of work. Or you could check it in the morning, depends on the severity of the condition, morning and afternoon. And then there's the option of the ambulatory, which continues.
Okay. Mm-hmm. Is there like an age that you could probably start paying closer attention to checking your pressure? Because, you know, like when with cervical cancer, this advice, you start at an age. For prostate cancer, you start at a particular age. Right. So, right.
So to quote an exact age, from the time you're an adult, especially, I would say. Mm-hmm. But because we are seeing it more common in children, it's increasing in children and adolescents. So I would say if your adolescent goes to the doctor, I think I would recommend that their blood pressure be checked, right? So I would say from all ages.
Okay.
Right? I mean, well, you do say, age 5 and so, unless the person comes with complications, right? But then if they come with complications, then that would prompt a doctor visit, right? That more than likely they will do normally at the.
Okay. All right. So, Tammy, what we could probably do is take a quick break. And when we return from the break, listeners, you will be invited to call if you have any questions. All right. You can post Dr. Williams. So we'll be right back with this segment.
Nothing else sounds as good as WEFM, the clean, fresh sound.
Sparrows, rum of your sophistication. Sparrows, rum, aged to perfection. Skillfully crafted and forged with time in oak barrels. A rum so divine. Discover authentic Caribbean rum. Sparrows, premium rum. Sparrows, full-bodied rum. Sparrows, pure sophistication. Discover authentic Vincentian rum. Sparrows, premium rum.
Distilled and blended by Vincent Distillers Limited. Please drink responsibly.
Agents, Careers, Distributions Limited. For over 20 years, Cubano Limited professionally delivers top quality products and exceptional service. Located in Sand Hill in Kingstown, we are open Monday to Friday, 8 a.m. to 5 p.m. And on Saturdays, 8 a.m. to 1 p.m. We supply animal feed, dog and cat food, animal supplements, a wide range of floral supplies, nursery pots, ground cover and shade cloth, and much more. We also stock a wide range of motor vehicle supplies, including automotive oils, filters for all vehicles, engine coolants, and much more. Email us today at Cubano_1 at hotmail.com or call us today 451-2911 or 493-7175. Cubano Limited, professional, top quality, and exceptional service.
Young man, we have a problem.
Think Leyu was back. Wait till Sunday, 5 p.m. Caliacor playing field. Labour Army is coming. Red and ready. With the boss of bosses, Prime Minister Dr. Ralph E. Gonzalez, Warren John, Curtis King, Kisao Peters, Dr. Orlando Bruce gangster and the financial mastermind that held SVG together through package will be epic. Touching down at AIA from Kingston, Jamaica. Chronic Law.
Yo, St. Thomas native. Look on greatness, the street now safety, no shake if you
Chronic Law.
So don't fall for me. Go credit to your friend.
Phenomenal local lineup. Rides, get your red horns, and transportation is free. So make your arrangements now. Calico ordered something big, and Labor will give you big. This Sunday, we're red and ready.
Make home yours every day with Courts. Oh yeah. Ooh. Get value for your money. Ooh. Courts have the best quality. Home is what you make it. Best prices and good credit. Courts have it all. Oh, yeah.
Courts. Make home yours.
Fast pay on you an easy way to pay. Fast pay. Fast pay.
You asked for it and you got it. A quicker way to pay your bills online. It's fast, secure, and easy to use. No registration, no additional fees. Flow is now offering FastPay, an online service that allows you to settle your bills in less than 2 minutes. Need a receipt? FastPay will send it to your email immediately. Use FastPay now for convenience, safety, and efficiency at discoverflow.co/fastpay.
Fast pay. 2 minutes and you're on your way. Fast pay. Fast pay.
Flow is keeping you connected.
WEFM, the new fresh sound.
WhatsApp us or call us at 457-9997. Activated Mornings on WEFM 99.9 is on now.
And the time right now, SVG, it is 8:36, and we are back with you, and we are continuing our discussion this morning on hypertension, causes, risk factors, and prevention with Dr. Tammy Williams. So remember, this is an interactive program, and should you have any questions for Dr. Williams, the number to call is 457-9997. All right, so while we wait on calls,
What are some of the, how can you tell, if it's possible, how can you tell if someone has diabetes? What would be the telltale signs? Nod? Hypertension.
Okay, so the telltale signs for hypertension. So, like I mentioned for us, right, which is very important, majority of the time it's asymptomatic, which means it does not have symptoms. Normally is when there are complications that arises that would arise later on, right? But if symptoms do present, you can have headaches, dizziness, nosebleeds in severe cases, ringing of the ears. You could have chest discomfort. A lot of the symptoms tend to be below the top.
okay. I've known of instances where, well, I suppose it's more than one individuals. It seems to have happened with, where they've had prolonged headaches for a couple of days and they didn't get it checked, right? Because most of us, if we have a headache, we're probably thinking that we just need to
Migraine.
have a migraine, or we probably just need to get more sleep, or maybe just something is on our mind and it's bothering us, right? And as a result, I've noticed that they passed away due to an aneurysm. What would you say to people, especially, you don't term yourself
That's
as
very
being
sad.
old?
My condolences to
Well, it's more than one person.
the
So it
family of
happened
that
with
person.
yes,
Okay.
more than one. What would you say to persons in terms of, and we tend to think of pressure as being for older folks in a sense, right? That's what we grew up thinking. But for some of these persons, they were relatively young or fairly young. What would you say to persons who, let's say, have had an onset of a headache? At what point do you think we should take it seriously enough to go and get it checked?
Okay. So headaches can arise from many different things, as basic as your period, or you're not eating properly, or you've done for too long. Say, okay, a one-off headache, you come home from work. It could be stress related too, right? And then stress is also linked with hypertension as well. But if it's, is a one-off like that, I would advise just monitor it, right? Monitor for frequent occurrences in the future. But if today is a headache, tomorrow is a headache, let's say the next day it stops, it ease up, but then the next day again it comes back, right? If it's like a pattern like that, I would urge persons to fault you, right? But medically accredited sites, please. But please do not. I keep on advising persons, do not try to self-treat. Sometimes what we think is actually not the issue, right? And then you could get very scared when you read the internet. Oh gosh, this is, so I would advise them to seek professional medical help where they can be properly walked up and treated if required.
Okay. All right. So remember, the phone lines are open. If you yourself happen to suffer from hypertension and you probably wish to give us some advice or your first-hand account of what it is that you're going through for us to, take it very seriously, you can go ahead and call us at 457-999.
I don't know if you know about the last part of this, right? But I guess these would be some symptoms or thing. They were saying blurry vision as well, swelling of the
blurry
feet.
Vision is one.
And this is the interesting one. They say if you press your finger on your skin and it doesn't rise quickly. Have you ever heard of that?
So what they're referencing to is a test that is carried out by doctors, medical doctors, for excess fluid in the body. So it's called edema, right? So it's specifically called pitting edema, the pressing thing that they're talking about. So basically, when you press down, I don't know, some persons might, if you've been admitted to the hospital, you might feel, see a doctor place their hands on your feet or your legs and wondering, what's going on here, right? So this is just checking for excess fluid, which can indicate that there is some kidney damage, which can be a cause for the elevated high blood pressure, right? Relevant to this situation too. But the pitting edema is when you press down and you raise up, normally the thumb is used, you raise up your thumb, there's an indentation, a mark left there, like a sink in, right? If you're not seeing that, then the person does not have the pitting edema.
Okay.
That was a comment?
Yeah. All right. Interesting. I had something there, but should I say more complicated or most complicated complications from hypertension?
Right. So,
and do any of those symptoms or complications have any similarities to diabetes?
Yes. Yes. So, like I had mentioned before, the heart attack, the heart failure, right? So something called LVF, left ventricular, and the link with diabetes is that diabetes can cause damage to vessels, right? And this can lead to the same suction and the strokes.
What causes us? What happens? I shouldn't say what causes, but what happens when you get a stroke? Like what exactly is happening to the body, or what has happened to the body that you call it a stroke?
Okay, so remember I was telling you about the blood clots formation, right, in the heart. What can happen, right? That blood clot can travel, right, to the brain, break off from its location in the heart and travel to the brain. And there are some tiny vessels in the brain right? I'm not saying I have to be in these tiny vessels. It could be in other vessels, but it's common in some tiny vessels in the brain. And what it does is that the clot blocks off the blood supply, right? So that is reduce or no blood flow to certain areas of the brain tissue, right? Which can result in death of the brain cells, right? And then when the brain is not functioning properly, this can lead to stroke, right?
Are there like pre-signs of a stroke though?
You can have headaches, you can have dizziness, you can have slurred speech, you can have weakness.
Okay.
Those are common symptoms. If you notice, somebody's not talking, there's like their hot potato voice all of a sudden, and that's not their usual, or their extra slurred speech. So, extra lag on certain words.
Okay. All right. We have Coach on the line. Coach, good morning.
Yeah, my question is, how often of an elevation you have to have? Because sometimes you eat certain food and you can build up pressure in your body, right?
Mm-hmm.
As you say, if you eat certain salty food, you can build. Because some people just definitely they love salt. So when they cook, their pot have to be really salt. So if you eat that, it could spike you. What I'm saying is, I'm not how often, like, is once a month you check and it's high. If it goes high every month, then you could consider yourself hypertension, hypersensitive.
All right.
You understand? How much
Yes, I understand.
Like, okay.
Yes, I understand. Thank you for your question. There is that there is no set specific one value to say you have an elevated blood pressure. Different guidelines would say different things. There's ACC, AHA, American Heart Association, American National Joint Committee. There are different guidelines, right? But the two outstanding numerical values that you would go based on, like I said, it varies and different countries would use different guidelines. But 130, it should not be more than either 130 on 80, and some guidelines use 140 on 90.
I know that many of the clinics offer several free services. So if I feel like I am unwell, could I just walk into the clinic and ask them to check my blood pressure? Because if I do have something at home, is that
yes,
a service?
That is possible. Yes, that is a service.
Okay.
Yes.
Okay.
Right. I don't think I have
for
any
other
more.
things like blood tests and so it depends on the clinic too. There will be a subsidized fee. But the blood pressure, that should be free of charge.
Okay. All right. So is there anything else that we may have missed in asking you? And is there anything else that you want to probably leave with us?
So let's not forget the psychological stress as being a risk factor. In acknowledgement of World Mental Health Day that recently went, that was on the 10th of October, especially occupational stress. It can be very demanding at times. I urge persons, if you really need a break, request a break, right? It can get very toxic.
Every Monday morning. I'm requesting my break, but good. Okay. So we spoke about it from the standpoint of the individual who has hypertension, but what messaging would you leave for those who are caring for persons with hypertension?
Okay. So those persons who are caring for persons with hypertension, I would advise them to be vigilant of the persons refer to them as signs, but really they are symptoms. So which we had discussed before, headache, hypertension, you won't really be too concerned, but what's providing you already have that background of hypertension, I would advise them to be vigilant with that. Even even the nosebleed, the things that you might not, those are so that can seek medical attention for the person, especially if they are too ill to do that on their own, to go to a doctor on their own, so they could help out in that regards. And also, also I would remind them of the daily blood pressure checks, especially for hypertensive patients. I mean, general population once a week might suffice.
Okay. And as well as,
and also to know the value, because like the caller had, that's a brilliant question that he asked. So they need to be aware of the value. So they would know, okay, if it's beyond this, then this person is to seek medical attention. Also too, I know I say to the values, right? But there's like a flexibility for persons of older age. So you may be comfortable, say, with 150, but it varies, right? So you still have to seek medical attention, right? But if you're constantly getting your blood pressure 150, 190, and you're 85, right? It might be accepted.
Okay.
Right.
And what about in cases that's a food preparation? Because we know that it could be difficult, possibly having to prepare 2 pots, right? I am not hypertensive, but whoever it is I'm caring for is. What would you say to those persons who are caring for those individuals? Maybe in a way not to either change their dietary lifestyle, or maybe not to feel so overburdened in terms of, like, let's say, the food prep.
Okay, so burden in what sense?
Burden in terms of, so if you have to prepare 2 meals because I need my food with salt, right? I prefer my food with salt, but I'm not going to prepare that type of meal for somebody who is hypertensive, right? So caring for that person, it comes down to being responsible and taking that responsibility seriously.
It can be a task. I understand the challenge there. What could happen, the person who is caring for that person, over time, you never know, maybe their body might get adjusted to the low levels of salt in the food, especially if you're using spices and other like herbs that do not have salt but would make the food more flavorful. You can get adjusted to that, and if not, I would advise that they cook separate, because you still want to keep within that salt restriction of less than 1,300 for hypertensive patients. 1,500 milligrams for hypertensive patients.
Okay. And as we started earlier saying, tis this season, and we talk about different seasons, but we know that Christmas season is coming up. Do you want to leave, let's say, a final message or early final message for persons who are hypertensive, given that we are approaching the Christmas season?
Okay, so yes, I know all of us, we love our traditional Christmas season every year, and we love to go by families and do the routine eating of everything processed, salty meats, including ham, salt hams, porks. But let us bear in mind the sad but unfortunate detrimental effects of excess salt in the body, leading to these sort of complications and diseases. Let's bear that in, and I think that when we remember that, we would limit our salt intake. I mean, one might say just one day, but still it's important to limit, right?
Okay. Yeah. And I suppose one of the things to note as well, that your health doesn't go on vacation, right? So you might say, yes, it's only one day. You're not going to change my eating habits to what it was after the Christmas season, but you might.
But the one day can do damage.
Bear the consequences, damage, right? And I suppose as a final as well too, is that we have to look out for each other, right? I think way too many times, many of us are enablers. We know that We have persons who are either hypertensive or diabetic. We have that plate packed with this and that and saying, well, you know what? Let me just serve you maybe veg and something else. We allow them to continue to eat. Now, yes and no, it's kind of difficult to talk to adults and tell them what it is that they should be doing or should not be doing. But us are enablers, and we don't pull up our loved ones as often enough as we should. So that's also something else there to note.
Yes, we need to motivate persons. I mean, it really have some stubborn people in the household, right? But I would urge persons not to give the importance with reiteration, right? Don't give up. I know. Also, I would like to urge persons to remember the importance of prevention. So remember what you eat. So there's something called DASH diet. So eat foods rich in fruits, vegetables, peas, beans, chicken, fish, especially as a healthy choice of meat, and limit your intake of foods rich in salt and high in cholesterol.
Okay.
Right? And also the lifestyle modifications, like avoiding, I should say try to avoid for persons who are really struggling, but the goal is to avoid, right? But one step at a time. Alcohol and smoking. And also, let's not forget physical activity. It is very important. I know sometimes we get up and I know I'm there. It's like, do we have to do this? Just remember the effects of it, the long-term effects. You want to live a healthy, long life, right? So 150 minutes per week. So which will be equivalent to, like, say, half an hour to an hour per day, right? For 5 to 7 days.
Okay. All right. So Dr. Tammy Williams, we thank you for being in studio with us this morning. And we discussed hypertension, causes, risk factors, and prevention. All right. So this is going to be a series of conversations. So we will let you know when the next one is, but it will be soon. All right. So we thank you again for being here with us this morning.
Okay. Thank you. One more thing, Roleza.
Nothing else.
Go ahead, Tammy.
Sorry. Let's pick up our groups too. We have diabetic and hypertension.
Okay. Sure? That's it?
Yes,
sure.
Is it. That is it. I'm done, Roleza. I'm done.
All right.
Finito.
So we're headed on out now.